Hello, my name is Dr. Thomas Reid, and today I'll be presenting our audit on improving preoperative pathways for high-risk patients living with obesity. In terms of background to our project, patients with class 3 obesity are associated with poorer post-operative outcomes. And given the systemic impact of this disease, these patients are more likely to require an extensive workup preoperatively, further considerations for joint decision-making between surgeons and anaesthetists, and potential pre-optimization if this is indicated. There's guidance that exists from SOBI UK to aid this, including a consent process which acknowledges some of the technical and specific anaesthetic concerns when treating these patients. At Guy's and St Thomas's Trust, patients presented for elective surgery with a BMI greater than 50 should be referred to the high-risk anaesthetic clinic. Our primary aims were to identify how many patients with a BMI greater than 50 are presenting for elective surgery, how they're pre-assessed, and are they consented in line with SOBI UK guidance. And we wanted to know, does this differ with specialty, and what is the duration between pre-assessment and surgery? The inclusion criteria for our audit were adult patients presenting for elective non-cardiac surgery with a BMI greater than 50 over the course of a year. We used the EPIC slice and dicer function to select out these patients, and then looked at their notes to consider their BMI, specialty, how they were pre-assessed, whether they were referred to HIRAC, and dates between pre-assessment and surgery. There were 78 procedures in total for 76 patients with an average BMI of 55. However, just over a third of these patients were seen in HIRAC, and only one patient was consented in line with SOBI UK guidance. This graph highlights the different pre-assessment settings where patients were seen. We also found that there was a significant disparity between specialties, in particular gynae and urology performing particularly poorly, and the average time between pre-assessment was between 50 to 60 days. This graph here breaks down the differences between specialty. So we found that 2/3 of patients are not being seen in the HIRAC clinic despite meeting criteria for this. The overwhelming majority of these patients are not consented in line with guidance from SOBI UK. And there is scope for pre-optimization if this is indicated, as patients usually have about 2 months prior to their surgical date. We tried to increase staff awareness by circulating the SOBI UK consent process within our department, and we're due to present to our pre-assessment nursing colleagues. We'd also like to circulate the RCOA anaesthesia on your weight leaflet when patients attend pre-assessment, and we'd like to make some changes to the EPIC user system by ensuring that weight and height are documented to auto-generate a BMI, prompts for referral to HIRAC as well as the obesity clinic if they meet criteria, and a smart phrase to aid documentation for the consent process if this discussion is being had.